Recently, the U.S. Surgeon General issued an advisory on the youth mental health crisis in America. The advisory notes that mental health challenges are the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 in the U.S. having a mental, emotional, developmental, or behavioral disorder. Additionally, between 2007 and 2018, suicide rates among youth ages 10 to 24 in the U.S. increased by 57%. Although those statistics are national, we know that this is a significant local crisis as well. Of the nearly 2,200 patients seen in the ED in 2021 with some form of behavioral health diagnosis, nearly 400 or 18% were under the age of 20. Of those, 84% were related to suicide ideation or attempts. Sometimes it's hard to tell if your child or teen is having mental health issues. As children grow and develop, their behaviors can change so quickly. When you see that your child is changing their normal habits around eating, sleeping, communicating with friends, or shifts in their mood and focus, they may be experiencing anxiety, depression, or other mental health concerns. It may be time for a mental health reality check with your child. Don't be afraid to talk with your child about their mental well-being. If behaviors persist or if you think something may not be right, talk with your healthcare provider. In the day of information at our fingertips, we often go to the internet to find information on mental health and well-being for ourselves or our children. As we search for information, it is important to make a distinction between what is credible on the internet and what is not. These are some credible sites to visit for good information. One place to look is St. Elizabeth's Activating Hope page. From this link, you will find links to credible resources for mental health, suicide prevention, substance use disorder, and ways to promote positive youth development. We are right here. Resources are available in primary care offices within the St. Elizabeth physician system. Please talk with your healthcare provider for options. Together, we are building a better, healthier community.